Okay, our final speaker for this session is Anne Chester. And Anne Chester is the Chief Vet of RSPCA in Queensland. Born and raised in Queensland, she developed a deep affinity for animals from a young age. This passion led her to pursue a career in veterinary medicine, and she completed her undergrad studies in vet science at the University of Queensland, graduating in 1988. It was a 2-week locum position 5 years into Anne's vet career at the RSPCA that saw Anne change her career path. Driven by her desire to make a broader impact on animal welfare, she joined RSPCA Queensland and has been with the organisation for 27 years. Anne has a passion for shelter medicine and has seen this fledgling branch of vet medicine grow as universities begin to incorporate it into their undergrad teachings. So Anne Chester joins us now to discuss prepubertal desexing of cats and its role in population management. Welcome, Anne. Forward, back, laser pointer. Forward, is that the green one? Yeah.
Sorry, I'm a bit stupid when it comes to technology, and that includes pointers apparently. So firstly, I'd just like to thank the conference organisers for inviting me to speak here today. Like Nadia, I'm also terrified and probably will have a trembly voice, so please forgive me. I do feel that I hopefully am largely preaching to the converted, but perhaps if there's some council policy makers present that might find this information useful when designing cat management laws. I did present this talk to some vets at the Australian Small Animal Veterinary Association conference earlier this year in an effort to convince my colleagues that this small change in timing of desexing, so we were talking about desexing, but this is about the timing of the desexings, could make a huge difference in the population management of cats. So just to make sure we're sort of talking about the same thing, I'm talking about prepubertal desexing, and that's desexing cats before they reach puberty at the age of about 16 weeks of age. So before cats are obviously physically capable of reproducing. And so on average, a 4-month-old kitten is around the 2.5 kilo mark. And I think it's really important that we talk about that, and it was important when I was talking to the vets because we'd sort of always pushed early age desexing, and I think people find that confronting, and I know that people in shelters like RSPCA and AWL and obviously lots of other rescue groups that are here, we've been doing confidently desexing kittens at that sort of 1 kilo mark, but it's almost a step too far for our colleagues. So if we can just get them to the 4 months, that would be a really huge step. And I actually wasn't going to say, I did go to my reunion on the weekend, and I wasn't going to say how long ago that was, but apparently I put it in my bio, so that was and even that, so that was a 35-year reunion, and I was talking to some colleagues and they said, oh, no, I just don't feel I can desex that, that 1 kilo cat, and, they're vets that have been out for a long time, so if we can get them to that sort of slightly older cat, we might have a chance. So the benefits of prepubertal desexing, obviously it's the elimination of the unwanted litters from pregnancies that may occur as early as 4 months of age. We push the fact that it's a shorter surgical time, and the recovering times to desexing of traditional age of the 5.5 to 6 months of age. There is no increase, bearing in mind we are talking about cats, there is no increase in risk of significant short-term complications or long-term adverse health effects, and there's well and truly documented health, welfare and behavioural benefits of desexing before puberty. And obviously one of the main reasons, those of us who work in shelters, is because we want the elimination of the risk of those unwanted litters. What are those health and welfare benefits? We know that there's a decreased risk of mammary carcinomas. We've been talking today about the fact that we don't want to see those behavioural things that make cats unpopular in the neighbourhood. So we get rid of those behavioural problems such as spraying and fighting. We reduce the spread of infectious diseases like FIV. But for the cats themselves and for the vets, it's a faster surgery time for both males and females. There's improved surgical outcomes because there's minimal tissue trauma and improved recovery times. There's also some indication, it was at Science Week in the behaviour stream, that it might increase kitten behaviour for longer, and we all love kittens, just not too many of them. I also pointed out to my colleagues that it would also eliminate that emergency 2 a.m. after hours call where people ring up because their cat's howling and they think it's very distressed, and you go out to find out the cat's just in season. So I thought that was a big plus. When we look at the research as to what the perceived barriers to prepubertal desexing are by veterinarians, they are worried about the size of the kittens and the development of the kittens. They do have a perceived GA risk, but we know that this practice has been done nationally and internationally for over 20 years, and there's vast amounts of literature supporting the practices. And we wouldn't do it. And we love animals. We wouldn't be doing it if we were worried about it. There are a few things that you need to consider, and I'll talk about those later. The concern that the surgery is more complicated, well, we know it's not. There's less blood and the surgery time is faster. There's no reason to, and that might be because if you're not working in a shelter, you don't realise that. But we do know, and research will show, that there are thousands of cats in the community who do not have homes. And if we desex at 4 months of age, these cats cannot contribute to that population. And so that creates a real benefit for the welfare of the cats, and obviously it makes ecological sense. And then we talked about lack of compliance from colleagues and clients. And I think it was just in Nadia's saying that people weren't really sure that they needed to, and that you could desex them that young. So I think it's still a matter of trying to educate both our colleagues and the members of the public. So, sexy numbers, maybe, sexy percentages, hopefully. I'll try not to make it too dry. So what does the research tell us? So a 2014 South Australia study showed that only 47% of owned cats were desexed at 3 to 6 months of age, and that 22% of those had already had a litter. In the same year, a study from Western Australia showed that 97.4% of cats were desexed by the time they were 2, but only 28% of them were desexed less than 2 years of age. And a 2021 study of 52,941 cats, so that's a lot of cats, that showed that only 62.6% of cats had been desexed by 6 months of age. So I did the maths on that, and if it's correct, I should have had it as a question so I could have got to throw a ball at someone. It's 19,799 cats that were not desexed and available for breeding. Just did a quick look at our RSPCA Queensland stats for fin year 23. We had 8,373 live cats and kittens came into RSPCA Queensland statewide. 30% of those cats were from owned, for private homes, and the remainder were 70% came in as strays. But of course, they could have been lost owned cats. They didn't necessarily all be free roaming or semi-owned. And of those cats that came in, only 72% were undesexed and 24% were desexed. We did have a small proportion that weren't identified on intake. And so there's a lot of cats that are coming in, entering the shelter undesexed, and RSPCA clarifies cats as anything over 4 months of age. This year in Operation Wanted, so Operation Wanted is a program that RSPCA has been running for, I think, 9 or 10 years, where for 3 months of the year we ask veterinarians and local councils to come on board, and we do a 20% desexing, 20% off desexing. And we noted that from the stats from this year that only 23% of the cats that were being desexed were under 6 months of age. So therefore, that 77% of cats, of female cats that were desexed, had had a chance to have had a litter. But it is improving. Apparently the stats are improving. So what are Australian veterinarians doing? So in 2016, said that they were most commonly recommending desexing at 6 months of age, with only a minority recommending it prepubertal desexing, but would specifically do it if requested. So at the conference, I specifically, on the behalf of welfare organisations, requested them to start doing it. I don't know how we'll go, but we had to start. And it was also interesting that a 2019 survey of veterinarians performed in the ACT, where apparently the legal maximum age of desexing is 3 months. The survey showed that only 10% of respondents were desexing them. A 2020 survey of veterinarians showed that 57% of the 57% of the veterinary practices indicated that clients were having their cats desexed later. So if you can imagine, if you're recommending 6 months and then they're getting it done later, that gives a large time for cats to get pregnant. And as I said, in addition, a substantial proportion of those cats had already had a litter. So what we're trying to get across is that timing is important. Yes, desexing is important, but timing is important. So there was a modelling done on a UK cat population which showed that even if the overall rate of desexing of own female cats could have a profound effect on all the cat subpopulations, both the own, stray, shelter and feral. And that specifically, even where the proportion of adult cats were desexed, if more cats were desexed before puberty, the population growth was lower. So the author of this research project said that this calls into question the practice of benchmarking the management of cat populations using the overall prevalence of own cats desexing alone, and that we should be suggesting that the timing of desexing, for example, before or after puberty, is an underpinning factor that influences whether a population is in a growth or decline. So who's currently practising prepubertal desexing? In private practice, the recommendations and practice of it is variable. There's a variation among veterinarians with different demographics, but obviously veterinarians who supply services to pounds and shelters are more likely to practice PPD with their own clients. But what was really important is that, because I think for a long time veterinarians have thought that this is a pound and shelter problem and that we only do it because, you know, that works for us. But it isn't just welfare organisations that are recommending it. And that's a long list. So many veterinary professional and feline welfare bodies are working group, task force, organisations around the world are already supporting and encouraging desexing before puberty. So if they're all recommending it, I think that we should be very confident that it should be a practice that veterinarians could take up. The Australian Small Animal Veterinary Association is also fully supportive, and the University of Queensland, which we're very happy to host all the final year students in at the Wakehole shelter. It's also part of their teaching program. These are some of my esteemed colleagues. So we have former AVA presidents who are saying that the appropriate age of desexing based on current scientific evidence that desexing can be performed as early as 8 weeks of age and a minimum of 1 kilo. Dr. Kirsty Sexel, who is a renowned registered specialist in animal behaviour and talks all around the world, said that she thinks early age desexing is positive for the cat, positive for the owner and positive for the community. And this is one that I thought was really good. So Professor Vanessa Bars, who's a registered specialist in feline medicine, head of feline medicine and infectious disease at the Sydney University, says that as a veterinarian and as an Australian, I love cats, but I also love our environment, and I would like to do what I can to see the number of stray and feral cats decrease in Australia. Unwanted kitten births will feed into that stray population, so whatever we can do to minimise that, I certainly advocate for it. And we know that a remarkable reproductive success of this species is a major factor in the ability of cats to colonise diverse environments. And we all know a single female cat can produce 40 kittens per year. So what are the differences? And there is there's lots of different anaesthetic regimes. RSPCA Queensland has its own. I canvassed all our other RSPCAs. They all had different ones. I talked to Teresa from AWL. They had a different one as well. And we saw from the talk this morning that from the vets at the Port Phillip Bay, where they were also using a different one again. So I think the old adage of what I said to the veterinarians is use an anaesthetic that you'll feel comfortable with, but we're happy to share our information. Basically, the main difference is from the surgery itself is that you get an excessive amount of peritoneal fluid. That's the fluid in the abdomen. And I can't tell you the number of times when I first started doing it that I thought I'd cut into the bladder and I was sniffing swabs. I was terrified, but it's okay. It's just a lot of fluid that comes out. And you just do the position of the incision a little bit more caudal, a little bit further down from the umbilical cord. And obviously it's a lovely small incision which can either be glued or it tends to be one suture. The main concerns are around is hypoglycemia and hypothermia, and so we make sure that we don't starve them. Like traditionally, you normally in the traditional age desexing, you say don't feed in the morning. We're feeding these kittens quite close to their surgery. We're also making sure that they're very warm at all times, using external heating pads, but also making sure that we're not clipping up a huge area, we're not getting carried away when we're spraying the alcohol, when we're swabbing down the disinfectant. Obviously, we're using smaller incisions, which is helpful, and we're also feeding these kittens as they're waking up. So that's just... We often let the litters also wake up together, but you keep them nice and warm, and those little kittens are just, you can see they're still a little blurry-eyed from their surgery. So the potential benefits, we talk about that for our 4 stakeholders. The clients, obviously, reduced visits to vets due to prevented diseases and illnesses of cat bite abscesses. We prevent the unwanted litters. We reduce the spraying behavioural problems and noise, and cats wander less and hopefully don't need the cat deterrent spray that the AWL is helping out with. Obviously, for the practice, it is recommended by many veterinary professional bodies. It reduces the number of unwanted and abandoned kittens, which also arrive on veterinary clinic doorsteps. We all know vets who are trying to find homes for kittens. It's a service that you can provide for your client and an increased income from the procedure because, quite frankly, you're using less consumables. The kitten, it's great, it's quicker recovery, prevents the unwanted litters. There's no evidence to suggest that there's any reason why you shouldn't, and there is evidence to suggest that it's less painful. And for us, it's an easier surgery, and we can play our part in population control and protection of wildlife. This is probably a little bit hard to see, but it is available on the RSPCA knowledge base, and it's just a comparison between really the only... obesity is one concern, but it's really no different if you do it pre-puberty or puberty. It's just a matter of making sure that you feed them adequately. So there really is, the other one that people used to be concerned was urethral obstruction, and there's no indication that that has any effect either. So our recommendation is by neutering cats from 4 months of age rather than the traditional 6 months of age, the veterinary profession can have a significant impact on the number of unplanned litters and therefore reduce the number of potentially homeless cats. And the RSPCA and AWL and every other welfare organisation would recommend that veterinary professionals discuss neutering with owners at the time of the primary vaccination course and proactively book those kittens in to be neutered from 4 months of age. Thank you.
So we'll squeeze in a couple of quick questions. So can I ask the presenters to come up to the panel table? And while they're coming up, a couple of prizes. Now, these are prizes that I can't throw around. You're going to have to go to the registration desk to collect. And this is for engagement in the question aspect of proceedings. So we have Sarah Briffa. We got Sarah in the audience. Sarah. So if you want to go to the registration desk at your convenience for a fantastic prize. And also to Samantha McKernan. Samantha. Well done, Samantha, for one of the most upvoted questions of the day. All right. I have no questions. Oh, there they are. Excellent. All right, our first question, and if the presenters could make sure that they're speaking into a microphone for the benefit of the recording if you are responding. This one is for Anne from Kelly. Is the main barrier to prepubertal desexing surgical comfort for vets? Are there any other benefits to waiting a few weeks longer? We do this at over 1 kilogram to get the cats out to adoptions quicker. Are there cost concerns holding on to kittens for longer versus health concerns desexing at around 1 kilo? There was a lot in that question.
There was. So RSPCA desexes them at 1 kilo. We're not hanging on to them. We're putting them up for adoption at that 1 kilo, if that was part of the question. This was really just trying to get veterinarians in practice, trying to give them a level of comfort to desexing cats that are a little bit younger than they normally would to try and prevent those oops litters, which we all know that occur. And we saw from the research that people are being recommended to desex at 6 months and it's waiting. So perhaps if we start at 4, they'll get done by 6. I don't know, but that was the basis on it. Does that answer the question, sort of?
Does that answer the question for the question
Otherwise,
asker?
Kelly, I'll be out.
Excellent.
Come and find me.
Question now for Cindy. Were there any other factors considered in the cat flu study, such as disease management or the introduction of calming sprays?
Is this on? The one that was 49 different factors, that study? Yes, probably. You know, those are really just Band-Aids. I mean, we need to keep cats out of shelters, we need to give them room, and we need to keep them moving. So it's really looking at, I mean, you're not going to get much. I don't even, it was cat sprays and what?
I think it disappears once you answer it.
Oh, sorry, I don't mean to be a Debbie Downer. Like, those things are fine, but they're not. Cats just need to not be in shelters.
Thanks, Cindy. Question now for Jackie. How has the council supported you in the cat desexing program, and what's the potential to expand to further suburbs?
We'd like more support. It's been slowly growing, and the animal management officers are coming on board. The council is one where the mayor went to prison, and they were very... when they said they would allow us to do it there, they voted to provide no financial support or in-kind support because they felt that that might be, not aligned with, it was something under the table, or, they're just being absolutely above the board. Now, things have been coming along a little bit. We've had $10,000 from them, and we've just got another small grant from them as well. What we wanted to do the whole of Ipswich, $240,000 people. We just don't have the funding, and I'm very grateful. I missed acknowledging RSPCA Queensland's assistance. They have been absolutely critical and fundamental to this program, because Bridget Bardot was only paying $46.70 for the cats to be desexed, and RSPCA Queensland would do them for that price, and they have got a fantastic surgery team and nursing team that are just, world class, doing over 60 cats in a morning, up until 2 o'clock. So really impressive. These programs are collaborative. They have to be collaborative, Animal Welfare League, the council. But I would say to anyone who wants to start one of these, if you can't get the council on board, go to another local government that will, because you need the help of the animal management officers. They know where the problem cats are. You don't want to have to track them after they've come into your pound or shelter. It's where the complaint is. Go down, find out, talk to the people, hear them about their complainants, and find where the cats are coming from.
Thanks, Jackie. We will have to wrap up there for afternoon tea. We've only got 15 minutes for this break, so we'll have to leave it there. Big thank you to all of our presenters from this session.